Hello and welcome to Differential Discussions. I'm Melissa,
And I'm Dave.
and we're back with another synovial fluid.
Oh, them joints. Them
Them
joints.
joints.
I'll tell you, Melissa, my joints nowadays, they're not as good as they used to be.
But they're nowhere near as cellular as this one.
Yeah, they're definitely far better than some of the slides we've been looking at, but getting old, man. Anyway, so yeah. So we're looking at low power as is good practice on almost anything we look at.
Yep.
We're big advocates for low power scans. Um, And so, we'll look around here and maybe look for any like big clumps or large cells or anything that kind of sticks out to us that might be of note.
Yeah. And then there's a couple of larger cells
Uh-huh. Yep.
on this one.
Yep. Yep.
And then
Yep.
otherwise it looks like mostly neutrophils, but at
Yes.
least it looks like there's something else with these.
Yeah. Right. Perhaps more interesting uh on the scale of boring to interesting. Yeah, it looks like a ton of neutrophils.
Yeah.
Mhm.
Go over.
A very well done slide.
Oh yeah, look at these nice huge shells over here.
Yep. Yep. Maybe that might not be a bad area for us to kind of peek at. Yeah. So when thinking about large cells that we might expect to find in the synovial fluid, monomax, and of course lining cells. So the tissue cells that make up the boundaries of the joint, we want to look for those. I call them synoviocytes. Maybe lining cells is another common term.
Yep.
And yeah, looks like, huh? Looks like they are in fact our lining cells.
Let's go down.
Mm-hmm. Beautiful. So I think one of the things that younger or people developing differential skills might struggle with are the vacuoles that are in the cytoplasm here. So initially vacuoles, I think of mono, max, and things like that. The coloration of these particular cells looks a little dark for me. What do you think, Melissa?
Yeah, because even when they're, I mean, I guess they could, I guess, theoretically be reactive histiocytes, but
True.
the nucleus is very round
Mhm.
and the borders of the cells are different.
Not, yep, they're different, right? So when we look at these edges here, they're kind of like, yep. So they look as though they got ripped apart from their sister brother, right?
Yeah.
Um, so despite the vacuoles, the other thing we could say too about the vacuoles, right? They don't look like the vacuoles that I see in monos typically. They
Right.
look very like uniform, and so they look a little bit different too.
They do. Yeah.
So I'm very inclined, given the color and the borders, to call these lining cells.
Yeah, and given that it's a synovial fluid.
Yes. Mm-hmm. Yep. Absolutely.
Yeah. And otherwise I think it's just neutrophils.
Yeah.
There's a degenerating cell here,
Yep. Yep.
those pyknotic ones, but I wouldn't, it depends on the institution, but I wouldn't call it based off of one
Yeah.
pyknotic
Yeah.
cell. I would just make a note of that and then move on.
Yeah. Yeah. Absolutely. But yeah, it looks like we're hitting our differential button a fair number of times here.
Yeah,
Uh,
newt, 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 newt,
yep.
newt, newt.
Yep. Yep.
All right.
So okay. So it looks like a mono Mac sort of cell down over here.
Yeah.
And then perhaps a lymphocyte up here. I could see a little like bleb of cytoplasm kind of
Yeah.
hanging off of it there.
Yeah. The other thing that I want to point out is this one you can kind of see the protein
Mm. Mm.
on the slide,
Mm.
which sometimes synovial fluids you can see that if not all of the hyaluronic acid was broken down.
Yep. 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 Oh, What a great point, right? So, side note, this is more relevant for the cell count itself and handling and manipulating synovial fluids, but one of the physiological well, the functions of the fluid is to be a lubricant, and as a consequence, they're very, very viscous. So we typically treat these with hyaluronidase, which breaks down hyaluronic acid, which gives it that sticky kind of thick. So if it's not all broken down, it can be a little bit tough to
Chunky.
handle, and you might get, yeah, and you might get chunky. Chunky is a good way to describe it. Yeah.
Yeah.
So
And then
most
the
are
other
just kind
thing
of noticing.
I keep playing with the fine tune for the fine adjustment is I was wondering if that's a hematoidin crystal.
Ooh, hematoidin crystals. So when you have um, fluid accumulation in the joint space, if there is bleeding, so if there's red cells going in there, they're going to get broken down eventually, right? So they're going to get digested. And so what's in red cells? Hemoglobin. What's hemoglobin made of? It's made of that heme ring, and it's made of essentially, I guess the other component that we'd see would be the iron itself. So two things with bloody fluids. You can see the hematoidin crystal, which is kind of just like bilirubin crystals. Melissa, is that an okay way to kind of describe it?
Yep.
And they're brilliant color, beautiful, bright yellow. And so
Yep.
we're looking at inclusion here.
It's right there. It's so tiny. It's a
Mm-hmm.
little bit shiny though, so I know hematoidin crystals can sometimes appear a little bit shiny.
Mm-hmm. Mm-hmm. Yep. So right here, we'd probably just make note, right? Like
Yeah,
yeah.
that's what I was just gonna say. I'm just gonna keep thinking about it and look around some more and see.
Yep.
Yeah, there's a lot of thick protein on this one.
Mm. Which also could be evidence too of like a transudate. So we could talk about exudates, excuse me, exudate. We could talk about transudates, exudates. I think for the most part, we should probably just use a fusion. It's the
Mm.
inappropriate accumulation of fluid in a space. But yeah,
Looks like a
I don't want
lymph.
to give. Ooh, it's a pretty blue color in there, huh? In that cytoplasm.
Yeah.
So kind of looking like a reactive lymph or something like that, right?
Yeah, I wonder if that's another one kind of squished in there.
It might be. On that one in particular, I probably would be reluctant
Yeah.
to say anything. But
This one's definitely a lymph.
I am gung ho on calling that one a lymph, probably a reactive lymph.
And actually, this neutrophil right next to it, it looks like it's starting to become pyknotic because
Agreed.
the purple looks darker with those weird white. It's not like white marbling like you typically see or like white striations. It's a different sort of random white, almost giving it like a cartoonish appearance,
Hmm.
which
Yeah,
is
I agree with you. He's like half dead, right?
yeah,
Yeah,
yeah.
yeah, yeah. And so in another video, we talked about how that might kind of give us an inclination that this is an older fluid, right? So maybe this effusion happened a while ago.
Yeah, it could be an older fluid, or it could just be the neutrophils are dying off because they're fighting something.
Very true, too. Very, very true. So in the time of infection, the turnover rate on the neutrophils will be faster for sure.
Yeah, and I just want to kind of come into this glob because look at how difficult it is to like really discern like some of these cells, like where is the line that separates them?
Yep. And this is where selecting an area is kind of important. So we don't want to purposefully just kind of move past relevant areas, but if there's tight areas and it's very congested and you think it might compromise the count,
Yeah.
you should do your best to avoid that.
So I think I would look at this area and be like, I'm gonna go find another area to
Yeah.
count.
Yeah.
But I still looked at this area to see if there was anything important in this area.
Great point. So just because you're not doing the diff there doesn't mean you can't find valuable information there. And I've mentioned it in our other synovial fluid videos, but we're looking for infection and possibly crystals. But I think we finally found what it is that's worth finding. Yeah. Yep. So those dark blue little dot specks, they look very organized and uniform. There's a bit of a diploid kind of effect. Don't know if they're strep or staph, right? But either way, they tend to kind of be stuck together. And then it's within the boundaries of the neutrophil itself, right? Which I think is important. It's hard to see that they're in a vacuole necessarily, but that right there, I would have pretty high confidence saying that there's bacteria present. Probably not unreasonable to ask micro for their 2 cents, but that looks like bacteria. A very important conversation to have with the care team.
Yeah, and usually we would go and check with micro and be like, hey, did you call bacteria? And if they say yes, then we're like, okay,
Yep.
move on. Kind
Absolutely. That's the other thing. We don't ever want to step in front of what they're doing too, right? Ultimately, micro is micro. So that's fascinating. So we saw one cell that looked like it had a lot of organism around it. So now as we do our differential and perhaps after, we might be looking a little closer.
I also want to differentiate it from like this, where like just some of these larger granules,
Yep.
when you look at them, you might think, well, are those bacteria too? But again, the bacteria that we saw were large, defined, clear cut bacteria. And if you look at something and you're like,
Almost always, if you have to twist yourself in knots to like say it's a thing, it's probably not the thing.
Yeah. Well, there's probably some more in here.
Yeah, I would bet. But this is illustrative too, that like even when there's bacteria present, it doesn't necessarily smack you in the face.
Well, and that comes back to the importance of scanning.
Yes. Yep. So yeah, I think let's talk a little bit about that too, because if I saw something questionable in my 100-cell diff and then I complete my 100 cells, it's all situation dependent, but I'm going to spend extra time just looking around for the findings, right? Like, oh, there we go. Yep. So more organism. Yep. Perfect. Yep. And you can see it stains different than the other things present on the slide.
Yeah.
Beautiful.
And it's important to note this isn't a gram stain. So we can't look at it and say it's gram pos, gram neg. We just know. We don't even say if there's cocci or bacilli.
Yes.
Like, we just say there is bacteria.
Yep.
That is not our call to say if it's cocci or bacilli, because we're looking at a Giemsa or a right stain or a right Giemsa stain. We're not looking at a gram stain.
Right. Very good. Yep.
The other thing is right here, there looks like there's some erythrophagocytosis.
Ooh, cool. Good eye. It's like right next to the bacteria and I overlooked it. But yeah, this is frequently what a red cell looks like when it's ingested. It kind of gets a little bit like muddy a little bit. Like it's hard to see where it begins, where it ends. But yeah, perfect. That's
well, in this one, it looks like it's in a pyknotic neutrophil.
It is. Yeah.
So like the neutrophil ingested it and then died.
His last dying action was just like,
It died eating.
Oh man, I have so many things I could say about myself.
Me too. I was like, I'm not gonna say it. All right, there's some more here.
Oh, more of them. Yep. Yeah, we got more organisms down in here.
Beautiful. Yeah, and let's contrast that with this.
Yeah, which I can say less about what's going on in here. What do you think?
This here just kind of looks like either granules or junk inside the mono.
Yep. There's too much variation between the particles or whatever they are. I would also say they're inconsistent coloration with what we've seen the organisms stain with, right?
Yep.
The organisms seem to have like a bluish kind of color. These are a little, was it purple, pink, you know?
They're almost that azurophilic color.
Yep. So although color can vary from
Yeah.
one fluid to another, they're consistent on the slide, right? So there's
Right.
going to be very consistent there. So super cool. I'm glad we got to see those organisms.
Oh, good.
Oh, lots of pyknotic.
So right here,
Yep. Wow.
next to some pyknotic neutrophils over
Yep.
there,
Yep.
and then some azurophilic granules and junk over here.
Yep. Good contrast. Yeah, we can see that they're different colors, and so likely different objects, different things. Yeah. Cool.
Yeah, but it's really easy to miss this bacteria if you're not paying attention.
Oh, 100%. Yeah.
Because what, like we probably scanned through like at least 20 fields before we found bacteria. So if I, like you said earlier, if I would have just counted my 100 cells and skedaddled,
You miss it. And we hope that micro picks up the pieces there, but still.
so nice, like the prominence of all that protein on this slide is.
I know it's really prominent in this area here, huh? How cool. So you almost have these, it's like a halo effect.
Yeah.
So.
And so notice how we're at the edges here, and I don't really see a lot of bacteria
Yep.
or any bacteria at the edges.
So the area that we told you to kind of stay away from, so if it's like really congested and like messy and it's all smushed together, it might not be a great area to do the differential, but it might be a great area to find things like bacteria. So I separate the procedure into the counting, the enumeration of the different categories of cells, but also the scan is really, really important. Look everywhere, really.
It just looks like some leucophagocytosis going on over here.
Yep. Yep. Yeah. And we get some cool vocab words here.
I know, right? You get to a point where you're like leucophagocytosis is natural to say, and then you
I
try
know.
to say like a normal word, and you're like,
That's me.
me too. Yeah, I mean, even here we're not seeing a lot of bacteria.
Mhm.
There's some right here. Oh,
I
this is
think
the
that's,
one we saw before.
yeah.
I was gonna say I saw that neutrophil before. That pyknotic cell. Let's go the other side.
Yep.
Oh, look at that pyknotic.
Oh, beautiful. Yep. How awesome.
That's really cool.
Yeah, and like super common for you to get those, like the numerous,
Yeah.
what probably were lobes. Could even be two neutrophils there. It's kind of hard to tell, but
Yeah, you're
definitely.
right. I think it's two.
Mhm.
You can kind of see like them right here.
Yep. Yep.
Yeah, it's hard to tell. Oh, is that bacteria right there?
Yes, it is. Beautiful.
We're
Good
all
eye.
focused on the pyknotic one, and hey,
Good eye. So, and we saw the organisms intracellularly inside monos and neutrophils. So,
well, makes sense. Those are our phagocytes.
yep. So be attentive to all the phagocytes. I think people too, they like neutrophils and bacteria are like hand in hand, so to speak. But
Yeah.
macrophages will do the work too.
Ooh, look at this one.
Oh, beautiful. Whoa.
He's packed.
That
Oh,
is
up here too.
awesome. And especially the ones on top of the nucleus here. How
Yeah.
beautiful is that? So what I'm seeing there, you can see the vacuole in a sense a little bit better because it's over the nucleus like that.
Mhm.
That looks awesome.
Yeah, and we should also just say like the vacuole wasn't in the nucleus. We
Right.
just took a 3D structure and smoshed it down to be 2D. So we're
Yes.
seeing it on top, what looks like on top of the nucleus, but it's because it's squashed to 2D.
Yep. Yep. Awesome.
But
That
yeah,
would give me, that's that one. And you know what? Right above it too. Wow, look at this.
yep, yeah.
Super high confidence now that I'm dealing with bacteria.
Mhm.
Yeah, that's awesome. And again, we looked at a lot of cells before we saw these really high signals. So be patient with yourself.
Scan.
Yeah.
Yeah. A lot of times you end up scanning the whole circle.
Yep.
It takes time, but
It's worth it though for these big findings.
yeah. Yeah. All right. Well, I think we looked at a ton of stuff. We found a good amount of stuff between some of the phagocytoses and the bacteria.
Yeah, this is a good
Um,
slide. Great
yeah.
teacher.
All right. Well, that's all we have for this. So thanks for watching.
Thank you for your time.